afternoon. My name is Danny, and as you guys may already know, I'm a consultant here at 305 Plastic Surgery. And this afternoon, we are going to be talking about a few things. I actually have someone that we invited. Miriam, how are you?
Hi, I'm doing good. My name is Miriam. I hope you guys are doing great too.
Miriam, we invited you here today because she's super funny, she's super fun, and we really wanted someone else from our team interacting with you guys. She's gonna be asking me some questions.
Yes, ma'am.
If you guys are able to drop in the comment section any type of concerns you guys may have, now would be the time to do so Miriam and I could go over it. Para las personas que me ven en español, mi nombre es Dani, yo soy consultante acá en 305 y el día de hoy, esta tarde, tenemos a Miriam por acá.
Hola, muchas gracias.
Ella va a estar acá acompañándonos el día de hoy y más bien va a ser como para interactuar un poquito con ustedes y que ustedes no solamente me vean a mí, sino que también puedan conocer un poquito más del equipo de acá de 305 Plastic Surgery, desde los doctores hasta las demás consultantes, las muchachitas del call center, absolutamente todo para que se familiaricen con nuestra clínica. Para las que no saben, 305 Plastic Surgery es la clínica más grande de cirugía plástica de la ciudad. No solamente porque tenemos un super mega edificio para ustedes, sino que también tenemos un total de 12 cirujanos en total. Aquí hay una opción para cada una de ustedes, sobre todo para esas personas que quizás tienen un índice de masa corporal un poquito más alto o tienen ciertas condiciones médicas por las cuales de pronto no pueden o no aprueba cierto doctor. Siempre va a haber una segunda, una tercera e incluso una cuarta opción. For my girls that are looking at the live in English, I was just saying in Spanish that sometimes we do have a lot of patients that feel really discouraged because of a high BMI. And sometimes you guys think that you're not able to get a cosmetic surgery because you have a high BMI. And that's totally not true. Actually, you can secure your promotion. And the doctor, if your BMI is a little bit higher than usual, your doctor will actually let you know exactly how many pounds you have to lose. So Miriam, tell us. You're in the call center,
yes,
right?
I am. Mm-hmm.
So when patients call in, you're typically one of the first people that they speak to.
Usually always the first ones to talk to you guys.
And what's a very common question that maybe patients call you for?
I get simple, honest questions like, for example, how long should you stay after the procedure, or exactly even what time pre-op is usually, just simple questions like that. I as well get lab questions, but if they should go to the same in their state, like laboratories or lab courts, or even their PCP. It honestly does depend sometimes on their doctor.
Okay, so you think we should talk a little bit about that?
Yeah, just a bit.
Okay. So as far as pre-op goes, if you guys have not yet scheduled a surgery or are planning on scheduling a surgery, the pre-op department basically is in charge of preparing the patient for surgery, making sure that your blood work is in, that it was received, that you got everything that you needed to get. There are some specific studies that patients have to do depending on the age and depending on the doctor that they're choosing and also the procedure that they're having, right? So when you guys come in for the first time, the first person you're going to speak to is either call center or your consultant. Your consultant is in charge of taking over your consultation, delivering everything to the doctor. And once you've already booked your surgery, that's when you go into the pre-op department and they make sure that they prepare you for surgery, tell you the do's, the don'ts, how to prepare, what to bring, what to purchase. We also have the billing department available for each and every one of you guys. If you guys end up wanting to finance, you can always reach back to the billing department and they actually help you out with an application. And then funny enough, right after you're done with surgery, that's not the end of it because we still have a post-op department that takes care of patients all the time after they're done with surgery. So that's as far as pre-op goes. Mm-hmm. You said the other question was how many days?
Yeah, usually of how many days patients should stay after the procedure. I get that a lot.
Okay, so, well, it depends. It depends on what surgery the patient is having. If it's a lipo, for example, or like a simple breast augmentation, maybe a breast lift with implant as well, you could do a total of 5 days altogether. If you're having something a little more serious, like a tummy tuck, for example, you should stay for at least 7 days. And then if you're combining procedures, anywhere from 5 to 10 days would be ideal. And what are the questions?
I also do get questions about drains. If how long should they keep them on, or drains about when should they be taking them out, or if they can take them out also at their own states.
Okay, so yes and no. So are you able to take out your drains outside our facility? 100%. A lot of patients that get tummy tucks done have to go back home because I know you guys have kids and you gotta work and you got your responsibilities and everything. So a lot of our patients do actually fly back with their drains, but our personal recommendation is try to stay in Miami for as long as you can, because we rather remove the drains for you so you can just go back home and not have to worry about anything. That's our personal preference. So anyone that has a tummy tuck scheduled or planning on scheduling a tummy tuck, that would be the ideal time, anywhere from 5 to 10 days. So you got a question over there?
Yes, I do. Somebody asked, has Miriam had anything done? No, I have not. Not yet. I've been thinking about it, but I haven't made my mind yet fully. Gonna give myself maybe another year or so, and then.
You're also super young.
Yeah, I'm also very, very young as well. So it just hasn't crossed my mind yet, but maybe, who knows?
All right, so you being the first kind of like responder to the patients, what other questions do they ask? I know we're moving up very, very, very much with the promotions that we currently have going on. So I know a lot of you guys have been receiving. Have you had questions regarding that?
100%. I get patients even that have, some of them that have even procedures from before, like 2 years ago, calling from now for promotions that we have going on now just to get a second round, or we pass you guys a lot of calls too, simply because they're calling and we're like, hey, we want a new promotion, or we see that this promotion, can we achieve it? Or I do get questions, what is on the promotions?
What is on the promotion? So we can also talk a little bit about that. So we created 3 different packages for our patients, right?
Okay.
So the packages are for the Lipo 360 and the Lipo BBL.
Okay.
So, for example, the basic package is the one that brings the least amount of things. It's also the cheapest one. So, there's patients that don't really like to have anything for free. They'd rather do everything on their own, and they're just interested on the procedure itself. So the basic package for Lipo 360 is $2,500. It includes your full Lipo 360, 2 extra areas of liposuction, and 1 free faja, as well as J Plasma. And we'll talk a little bit about J Plasma in just a second. We also created the premium package for you guys, and the premium package actually includes a little bit more than the basic. It includes everything from the basic, but also it includes 3 free lymphatic massages, and you also get your pre-op labs included within the package. That one is starting the lipo for $3,000 and the BBL for $4,000. Now, if you want to add a little more stuff and you kind of want to not have to worry about much once you arrive here, you can get the plus package, which actually includes everything from the basic, everything from the premium, and you also get something called Cell Saver. If you do not know what Cell Saver is, I think now would be the perfect moment for all of you to understand the benefits of Cell Saver, why it's so expensive, and why we have decided to add this on to your package for free. You also get your pre-op package included in the plus package. What is the pre-op package? It's just basically your pre-op appointment, of course, but it's tied to drug, nicotine, and pregnancy tests. So that is a requirement for all patients to have these 3 tests done the day prior to surgery. You can't get it back home. You can't get it the day of. You have to get it the day of pre-op. So that's actually $100 alone, but in the plus package, you literally get it for free. So those are the 3 options, Miriam, that we have for our patients right now.
Okay. I actually do, now that I think about it, I do get patients, for example, ones that like to smoke nicotine and marijuana as well. I get a lot of those patients. What can you tell me about that actually?
Okay, so whenever you're planning on having a cosmetic procedure done with us or basically anywhere, you gotta make sure that you are in a healthy state, which is why the consultation process is so important for patients, so we can actually discard certain things. And one of the questions that are in the medical assessment are, do you smoke, do you drink, or do you consume any type of drugs, right? Now, anything that you consume prior to surgery, including the way you eat, is very important to prepare. So no nicotine, no tobacco, no drugs, no alcohol, and a very healthy and balanced diet. For example, if you're the type of patient that needs to gain a little bit of weight, we're gonna let you know, hey, just have a higher protein intake, take some more carbs, good fats, as well as patients that have to drop weight. Hey, you got to lose this amount of weight. We recommend you do this type of diet or maybe some detoxing tea. So I feel like whether it's just, smoking or drinking or whatever, that is tied, and you should quit anything like that 30 days prior, but also, have a decent diet as well as that. Take your vitamins, take your supplements. If you're anemic, for example, you should always be taking some Hemoplex right before surgery just so you can get your hemoglobin up, or kind of use the Cell Saver device as well to not drop your hemoglobin level so much. So if you guys have certain medical conditions or things like that, that's also part of the medical assessment.
That's great.
What are the questions?
Thank you. Let me see. I do get a lot of questions. I as well get questions upon patients if they should be coming alone or with someone.
Okay. So all patients must be in the company of anyone over the age of 18, whether that's your son, your daughter, your cousin, your friend, your whoever it is. A companion over the age of 18 should be with you at all times. Now, if you are coming absolutely by yourself, this is very important because it has happened before. If you are planning on coming all the way down here by yourself, you have to book either a post-op service or you got to go to a recovery home. And we get this question a lot as well. And it's if we own a recovery home or not. Truth is, we do not. We're also not affiliated to any type of recovery home or post-op service whatsoever. It's always the patient's job to do research and to find the best fit place for you if you plan on staying in a recovery home or even get some post-op services.
Perfect. I actually have a question here. The question says, what is the difference for a breast job with an implant behind and in the front of the muscle?
Okay, so it more so has to do with how natural you want the breast to look, right? So typically for a more natural look, they try to put it either half under, half over, or maybe totally behind the muscle. When you get it over the muscle, you do get a lot of more higher projection, but I feel like over time the implant is more likely to drop down rather than if you put it under the muscle, it kind of stays in place for much longer. So that's one of my favorite parts about breast augmentations, placing it underneath the muscle. I'm also a big fan of mesh bras inside the breast when needed. And that's also a very common question that we get from patients. Sometimes patients have had one or even two breast procedures. Maybe one was a breast augmentation when they were really young. Then maybe it was a breast lift after they gave birth. And now they kind of maybe want to change their implants. When you've put the breast area through a couple of trauma over time or over the years for having several surgeries in the same area, the mesh bra actually holds in place the implants and it actually prevents them from dropping so much as time goes by. So I think that right now, one of the most popular doctors we have for breast is actually Dr. Sadio. If you do not know who Dr. Sadio is, you gotta know who Dr. Sadio is. She's our most popular doctor for breast procedures, but also for Lipo 360 BBL and breast combinations. She also does wonderful mommy makeovers, tummy tucks, and she's also part of the current promotion we have going on right now. If you wanna know about the promo, let me know and I'll go ahead and explain it.
Perfect. She actually had the same similar question to it. She just wanted to know, would it feel more natural under or over it, like the muscle?
I feel like it looks more natural when you do it under the muscle or when you do half over, half under. Actually, about like 3 months ago, this TikTok trend went super viral because Kylie Jenner actually gave, I don't know if she commented on someone's TikTok that she had what size?
It was a Twitter post. She made.
Or it was a Twitter post. Well, you know more about social media than I possibly do.
It became a huge trend. A lot of people started doing it too.
And everyone, that week we had so many calls coming in like, do you do the moderate implant, half over, half under, this size? And I do want to take advantage of this comment and that situation with Kylie Jenner because you got to think about your body type. So when you're doing or when you're planning on having a breast procedure, you always want to measure your chest, your torso, and your back. And we actually do it for you here when you come for pre-op. We allow you to choose whatever size you'd like, but we also give you a recommendation as, okay, this size that you chose is super good, or hey, I think we should go a little bit over, or we should go a little bit underneath the CCs. And you know, you're always able to determine the specific type of implant and size that you want the day of pre-op.
That's actually really good. Yes. And then I have a question here in Spanish. It says, ¿puede enseñar a alguien con like 520 cc's?
So, creo que sí, por ahí debemos tener alguna foto o algún video de alguna paciente que se ha hecho implantes de 520 o quizás sobre los 500. Acuérdense que la contextura de cada persona es diferente. O sea, yo soy una persona delgada y Miriam también es súper flaquita, pero por ejemplo, ella tiene un torso un poquito más angosto que el mío. Yo soy un poquito más ancha. Entonces, casualmente de eso estaba hablando en inglés justo ahora que terminé y yo decía... popularidad, la doctora Sadio es ahora mismo la más famosa haciendo senos, ¿verdad? Entonces, ¿qué pasa? Que ella te mide el pecho, el torso y la espalda y ok, tú quieres 520 cc, perfecto, pero a tomarte la medida yo creo que podríamos hacer 550. Por ejemplo, ya no estás poniéndote 520, te estás poniendo 550, que es un poquitico más, pero siempre siguiendo las recomendaciones de los doctores para que puedan obtener los mejores resultados. Lo mismo sucede cuando quieren un aumento de senos, pero de pronto son mejores candidatas para hacerse un levantamiento con aumento. Cuando tú pones un aumento solamente, lo único que le estás dando al seno es volumen, pero si ya tienes el seno caído, igual se va a quedar caído y no luce bonito. Es mejor que te hagas un levantamiento con implante y te sale mucho más barato.
Okay. And then let me see. I was thinking about some other questions. Oh, sorry. Y peso 118 y me dijeron que 50-20.
Ok. So, Giuliani, pesa 118, ¿verdad? Y quieres ponerte 520. Tú puedes ponerte realmente el tamaño que tú desees, ¿verdad? Pero por lo menos te puedo hablar de nosotros y es que nosotros siempre el día antes de la cirugía te vamos a poner frente a un espejo. Ok, Giuliani, ¿tú quieres 520? Mira, aquí están los implantes de 520, póntelos en tu brasier, mírate en el espejo, cómo te sientes, qué te sientes en la proyección, los sientes muy cargados, los sientes livianos. Y de esa manera es que llegamos exactamente al tipo de implante o al tamaño del implante que sería mejor para ti. Que luzcas como quieras lucir, pero que también sea algo que vaya acorde a tu cuerpo para que se vea lo más bonito posible. Pero la paciente siempre va a tener la posibilidad de escoger el implante, tanto el material, ya sea salina o silicona, o el tamaño que tú desees. Ahora, 118 es bien delgadita. Ahora, ¿qué tan alta eres? ¿Qué tan ancho es tu torso? Todas esas cositas las vemos durante tu consulta. Te recuerdo que tu consulta con nosotros es totalmente gratis. De hecho, lo único que tienes que hacer es llamar al numerito que ves en la pantalla sobre mi cabeza para que te puedan contactar con una consultante. Si necesitas a alguien en español, al día de ayer tuvimos aquí a Vanessa, que es una de nuestras consultantes. Puedes llamar y preguntar por ella o llamas y te transfieren a cualquier consultante y créeme que te vamos a poder ayudar.
Okay, so I have two questions here. ¿Es posible hacer se podría hacer alguien un petit BBL? Like a small skinny BBL?
Sí. So, a veces me da gracia el concepto de skinny BBL o Petite BBL, porque realmente es lo mismo.
Yeah.
Es una lipo 360 con transferencia al glúteo de la cadera. Lo único que sí cambia un poquitico es que obviamente la cantidad de grasa que te vamos a extraer y a transferir no va a ser la misma de una persona que tenga de pronto un índice de masa corporal un poquito más alto, ¿verdad? Pero el concepto es el mismo. El paquete más económico que tengo para lipo BBL en este momento es el de 3.500, donde te vamos a regalar 2 áreas extra de lipo, una faja totalmente gratis, y también te vamos a regalar el J-Plasma para que ayudes a tensar la piel si sientes que tienes un poquito de flacidez o elasticidad.
The other question was, can you feel the implant if it's under the muscle?
I don't know what you mean by you feel. Do you mean like, will it hurt? Does it hurt more? Is it more uncomfortable? Is it less uncomfortable? I'm not sure. I don't have implants myself, so I can't speak about do I feel it or do I not feel it. But I can tell you that I've been in this industry a very long time, and I've never had a patient complain about feeling it or being uncomfortable with it unless they've had the implant for some time and it capsulates. Mm-hmm. When an implant, or you go through a capsulectomy and you need a capsulectomy, that's when it becomes bothersome. Mm-hmm. But other than that, you don't really feel absolutely anything. It's gonna feel funky the first few weeks, maybe the first few months while you accommodate to the new size and just having something there. But as a matter of fact, I've never had anyone complain about being uncomfortable. My mom, for example, she had her breast done years ago. She's super good. Vanessa, who's one of her coworkers, had her breast done 17 years ago. No one really complains about it unless you experience a capsule. That's different.
Y después también preguntando, ¿se siente más el peso del implante? Like, I'm guessing the weight of the implant, if you could feel it.
Yeah. The question's in Spanish?
Mm-hmm.
Yeah, so sí, obviamente cuando tú te vas a poner, es como si tú coges, vienes y te pones una pelotica que así esté desinflada, te la pones ahí, tú vas a sentir algo porque no estás acostumbrada. Pero simplemente toma tiempo acostumbrarte a tu nuevo tamaño. De pronto si te hiciste algún levantamiento, pues acostumbrarte que vas a tener una pequeña cicatriz, pero siempre y cuando tú te cuides tu cicatriz con tu cremita cicatrizante, tu cinta cicatrizante, todo va a salir súper bien. Muchísimas veces las pacientes ni siquiera se les logra ver la incisión o la cicatriz después de los 3 meses. ¿Por qué? Uh-huh. Porque no fumaron, no tomaron, se cuidaron, se pusieron su brasier postquirúrgico, se echaron sus cremas, se pusieron sus cintas. Por eso es súper importante seguir todas las instrucciones postoperatorias, porque acuérdense, el 50% lo va a hacer tu doctor y el otro 50% lo vas a hacer tú en dependencia cómo cuides tu recuperación.
That is 100% true. 100% true. Let me see. I'm trying to think of other questions I have.
Think you not have gonna lie. There?
Actually, one just came in. Ooh, that's in Spanish. You're gonna have to take that one for me.
Okay.
It's a little longer for me.
Okay. Vamos a ver quién está por aquí. What about BBL? All right. So for BBLs, I really have a super awesome promotion going on right now. If you want the basic package, which is like the one that doesn't include many stuff, the BBL is $3,500. You get 2 extra areas of lipo, 1 free faja, and you also get free J-Plasma. If you want something else included and kind of want to spice it up, you could do the premium, which you will get 3 lymphatic massages, blood work, plus everything that the basic includes for $4,000. And then the plus package is $4,500. It includes everything from the basic, everything from the premium, and then the plus also includes the Cell Saver, which is awesome. If you don't know what Cell Saver is, let me know in the comment section because I love to talk about Cell Saver. And it also includes your pre-op labs. So drug, nicotine, and pregnancy test, which typically has a cost of $100. You always got to pay for it the day of pre-op, but in this case, it's totally free. Giuliani dice, ya fui y me operan. Ay, tú te operas mañana. Ya me fui, me opera mañana con Álvarez, pero me da miedo lucir exagerada. Mira, tú, Giuliani, mira, yo me acuesto en mi cama el día de hoy y yo hago así, yo me pongo mi sábana y confío en absolutamente todo porque el Dr. JC Álvarez es un espectáculo. Te van a encantar tus resultados, vas a salir de ahí directico, que lo que va a tocar es cogerte así, ponerte dentro de una cajita que diga Barbie. Divina vas a quedar, lo que te vayas a hacer, vas a lucir excelente, te llevas a un gran doctor. Vamos a ver. Celi dice por acá que Vanessa no te ha contestado. Celi, déjame, le doy un screenshot a esto para mostrárselo a Vanessa. Ok, Natalie manda carita de corazón. Hola Natalie, ¿cómo estás? Nilda dice, me hice una abdominoplastia y un levantamiento de senos. Quiero hacerme una lipo 360. Y cuando me llegan estas pacientes así, a mí me encanta, me fascina, porque hay algo muy curioso de la abdominoplastia. Y esa curiosidad de la abdominoplastia viene siendo que cuando uno se hace un tummy tuck, como te reconstruimos el músculo abdominal, no podemos hacer lipo en esa área porque es demasiado trauma en el área y por otra serie de cosas más. Entonces, después de un tiempo, como ya el cuerpo no tiene dónde expandir la grasa y ya no se puede crear más exceso de piel porque ya te retiramos todo el exceso de piel, se forma como una barriguita en la parte de acá del abdomen. Entonces yo le digo el tummy tuck pouch porque siempre está como que en la parte superior del ombligo y la barriga tiende a verse así. Entonces, normalmente muchísimas pacientes que se hacen abdominoplastia siempre vienen 1 año o 2 años después o 3 años después, pero al final del día siempre se terminan haciendo una liposucción porque el tummy tuck es para retirar el exceso de piel y la liposucción siempre va a ser para extraer, limpiar y darle contorno al cuerpo. Así que una lipo 360 siempre es espectacular que se la hagan después de una abdominoplastia.
Hay un poquito de preguntas. Actually, tengo uno. ¿Cuánto tiempo tengo de esperar antes de empezar el gimnasio después de hacerme los senos?
Normalmente deberías esperar 3 meses, dependiendo cómo te sientas. Cada cuerpo es diferente, cada quien se recupera de manera diferente. Yo diría que por lo menos unos 3 mesecitos deberían no hacer peso, porque el peso en los senos puede ser un riesgo para que el seno se encapsule y de pronto te queda uno más alto que el otro. So, lo mejor es no alzar peso hasta que el doctor te dé instrucción. Para las que se hacen los senos, siempre se les va a dar un manual como de instrucciones o el departamento de postoperatorio siempre les va a estar llamando para dejarles saber, mira, no puedes hacer esto por tanto tiempo, te recomiendo que hagas esto. Toda esa información se le da a las pacientes una vez agendan.
Tengo aquí una pregunta. Tengo 224 libras y me quiero hacer una lipoescultura.
Ok. Tú puedes pesar lo que tú desees, lo importante es sacar tu índice de masa corporal, que es el BMI, ¿verdad? Entonces, si quieres, déjame tu peso con tu estatura en un solo comentario y entonces aquí calculamos el BMI un momentico y te dejo saber inmediatamente.
Yo quiero lucir como una Barbie. ¿Qué tengo que hacer?
Cristi, ya tú luces como una Barbie, mi amor. Ya tú eres una Barbie, mi cielo. Cristi es paciente de nosotros acá en 305 Plastic Surgery. Recientemente se operó con el doctor Brewster y se hizo una lipo 360. Cristi, te mando un beso enorme, mi amor. Ahorita te veo.
A question under it says, do you get sensation back in the breast if the implant places behind the muscle?
I think sensation has more so to do when you do like an incision on the nipple. So you know how you open up the nipple to place the implant inside. That's why a lot of the times recently, a lot of doctors like to do the incision down here because you just put the implant and you're less likely to do sensitivity in the nipple area. So it doesn't really matter if it's over or under. It more has to do with the incision. So remember, medically speaking, your nipple is here and this is your breast, right? So your nipple, if we cut it, you're detaching the skin from the other portion of the skin. So that's not receiving oxygen. And it actually, since it lacks oxygen, it kind of like dies off. So the nerves die off. And that's kind of what makes you lose the sensation or the sensibility in that area. So when it's breast procedures, some doctors like to do it right underneath here. So that is less likely to happen. And then if it's done through the nipple, breast augmentations are typically very quick procedures. So we don't like to leave the nipple just kind of open like that. We like to do it a little bit quicker. So it kind of depends how your breast size is. Also, if you have like a super, super small nipple and the implant you're choosing is a bit larger, we also tend to do the incision underneath the breast so that we don't cause too much trauma to the nipple.
Okay. Y después que tengo a alguien que dice, me quiero hacer un BBL.
Claro que sí, todo el mundo se puede hacer un BBL. Yo me quiero hacer un BBL, todo el mundo se quiere hacer un BBL. Creo que es el procedimiento más popular que hay en la clínica, también con el aumento de senos. El aumento de senos y la lipotransferencia, que es la lipo BBL, es lo más popular. Y creo que es porque lo que más dimensión y cambio te da. O sea, tú puedes ser delgadita, cuadrada, te haces una lipo, inmediatamente cogiste figura. Si de pronto te sientes que estás un poquito gordita y lo que quieres es de pronto bajar de peso, te haces una lipo, inmediatamente te ayudó. Bueno, que de pronto sí tengo bonita figura, pero de pronto tengo esos huequitos en la cadera y de pronto quiero un poquito más de proyección en el glúteo, tal, lipotransferencia, se arregló. Solo la lipotransferencia como que ayuda y abarca muchas áreas al mismo tiempo y yo creo que por eso el cambio es tan notorio cuando te haces una lipo BBL, independientemente si es una petite o una skinny BBL o un regular.
Tengo aquí que dice, ¿cuánto cuesta el BBL y aumento de senos?
Ok, so el aumento de senos te está saliendo en 2.800, tanto para salina como para silicona. ¿Cuál es la diferencia? La diferencia es que la salina te la vas a tener que cambiar dentro de 10 años y la silicona prácticamente va a ser de por vida. Por el mismo precio, prefiero silicona. Ahora, el BBL tengo 3 paquetes disponibles. Tengo un paquete de 3.500, un paquete de 4.000 y otro paquete de 4.500. Esos son los 3 paquetes que tengo disponibles para lipo BBL. Ahora, cada paquete incluye algo distinto y por eso creamos 3 paquetes diferentes. Si tú no sabes lo que incluye, nomás déjamelo saber en los comentarios para poderte ayudar y contestarte esa pregunta.
Perfect. And then, honestly, I wanted to ask myself as well, what's the minimum BMI for a lipo or BBL that you would consider? Like minimum.
Well, I'm not a doctor, so by experience, I can tell you that the lowest BMI I've seen a patient do lipo or lipo BBL with has been 18.
Oh, wow.
Yeah.
Okay.
It was actually, she did it with Dr. JC Alvarez. And she had to gain a little bit of weight, but it was more for like athletic purposes. She actually played volleyball and she wanted more of an athletic look, but she was lacking the shape of the waist. So her main goal or her expectations was just to narrow down her waist a little bit more and kind of like mark her abs. She looked super beautiful afterwards. It was a very natural result.
Perfect. I just wanted to ask.
So yeah, I feel like there is no like limit as far as how low of a BMI you are or how high you are. If you know you're on the lower side and you want that nice pretty projection in your booty and your hips, you already know you gotta just gain a little bit of weight. Typically, patients that have to gain weight or patients that have to lose weight tend to schedule out at least 3 months in advance so that they have, 2 to 3 months to kind of go ahead and either gain the weight or lose the weight. A lot of our patients also go on weight loss medications prior to surgery, but you gotta stop 30 days prior to surgery, okay? And I think we could be over with the questions. I don't think we have anything else. Do you guys have anything else? No? Nothing? Nada? Okay. Perfecto. So, Miriam, thank you for being with us here today.
Thank you for having me.
As you guys know, my name is Danny. I'm a consultant here at 305 Plastic Surgery. Do not miss the chance to do your dream surgery with us. We're the largest cosmetic surgery facility in Miami. We have the largest group of surgeons. We have financing options for each and every one of you. I don't care if you have good credit. I don't care if you have bad credit or it's regular. Whatever the case may be, we're still going to have an option for you. If it's not like that, we can do in-house financing. Anyways, the options are endless. We have free consultations. We have a total of 12 doctors. If you don't like one doctor, you have 11 other doctors to choose from. We take high BMI, low BMI, medium BMI, certain medical conditions that may be in other facilities or some other doctors don't take. We have board and double and triple board certified plastic surgeons. So it's just a matter of you giving a try. Get a free consultation today. Select the secret offer that we have going on right now. All you got to do is either send us a DM privately on Instagram or give us a call directly to the number that you see above me. You can take a screenshot of it, call us now, call us later, or call us tomorrow. And nothing. I hope you guys have a wonderful rest of your day, and I will be seeing you guys tomorrow at 12:30 p.m. Miami time. Bye, girls.